This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center. We're in the Vince Lombardi Cancer Clinic. Now today we're going to be meeting one of the newest oncologists here in Oshkosh, Dr. Shamsuddin Virani. And today we're going to be talking about a subject that we hear too much about too often, breast cancer. Dr. Virani, thanks for taking some time with us today. I know you're relatively new to the Oshkosh area. Can you tell us a little bit about your background?
Sure. So I moved to the Oshkosh area recently, and I used to be at an academic medical center in southeast Wisconsin prior to moving to Oshkosh. There I was seeing a variety of patients, blood disorders, benign and malignant hematology, general oncology, and my specific focus was breast oncology.
Yeah, and why is that? I mean, it seems like it's a, people think of breast cancer and, pretty devastating diagnosis, but there's a lot to breast cancer, isn't there?
Mm-hmm. What interests me in particular with breast oncology or breast cancers is the biology. All breast cancers are not equal. These cancers can vary in forms of their aggressiveness and exhibit certain receptors or switches that may cause them to be less aggressive or more aggressive. And depending on those switches or the biology, we're able to tailor treatment to that individual patient. So our understanding of the biology is what interests me a whole lot.
So with the different types of breast cancer, I would imagine each one can be affected by different risk factors as well.
Right. In general, I lump them into two broad categories. One is the patient-related factors, and patient-related factors, some of which are not modifiable, of course, such as your age. Women who are 65 and above are more prone to developing invasive breast cancer as opposed to younger women. And then your gender. Breast cancer is far more common in females as opposed to males. If you've had a personal history of benign breast disease, if you had a family history of a gene mutation such as a BRCA1 or BRCA2 gene mutation, or if you're a carrier of that particular gene mutation yourself, then there are certain hormonal-based factors, patient-related factors, that is early menarche or late menopause, your age at your first childbirth. And why are those things important is because that's the amount of estrogen that you're being exposed to during your lifetime. And as we go along, I can talk about the estrogen positivity. What that means is almost 70% of the cancers have these estrogen or hormonal receptors, and our thought is that they are being propagated or fed by body's own internal hormones. And so that's important. Then there are certain other factors such as having or had radiation to the chest in the past, for other conditions such as a Hodgkin's lymphoma, and that's typically a disease of the young individuals, and certain lifestyle factors. So having physical inactivity, which essentially could lead to having a postmenopausal obesity. And the data on physical inactivity and smoking and alcohol consumption is increasing by the day, but it's thought to be a risk factor too. So a lot of an interplay between the patient risk factors, genetic risk factors, hormonal risk factors, and some lifestyle factors.
Yeah. Seems like as society we're doing a better job of screening. How important is screening right now?
So again, screening is the best way to detect cancers early. And in breast oncology and breast cancer world, mammography has made a huge impact, a huge difference. We are seeing in terms of trends that breast cancer is being diagnosed earlier, at an earlier stage, and that facilitates treatment planning and overall outcomes.
Well, when we talk about screening, there's a couple different thoughts on how often a woman should be screened as well.
Yes, the United States Preventive Services Task Force, I think a couple of years ago, they revised their guidelines in saying that women should have screening mammographies starting at age 50 and every 2 years. The position of the American Cancer Society remains that mammography should start at age 40 and once a year. And everyone over 50 should definitely have a mammogram, but patients who are between 40 and 50, and I think all institutions would agree on it, that patients should talk to their primary care providers or to their healthcare providers and try to ascertain if it is of benefit for them to get a mammogram sooner than age 50. And this is true for all the standard risk females. Now, if you're high risk, which again means if you've had one of those genetic mutations, or if you've had a family history, or if you have other increased lifetime risk, then you should be screened perhaps with different modalities such as an MRI, and talk to your doctors about what are some of the risk reducing options. And those could be as simple as some chemo prevention or a pill that you take once a day, or risk reduction mastectomies, and everything in between.
Right. A lot of different options, so many treatment options, whether it's surgery or chemo or different things. And I encourage everyone, if you have questions, to give Dr. Virani a call or call the oncology department. But one of the great things I want to get to, because we're running out of time, is the team approach that they take here at Aurora when you are diagnosed with cancer.
One of the things that we do here is we review each case in a multidisciplinary conference where the radiation oncologists, the medical oncologists such as myself, the surgeons, the reconstructive surgeons, the pathologists, the radiologists, nursing and support staff, we all sit and make a unified multidisciplinary plan so we know what direction the patient's going for. Another aspect of it is having a dedicated breast cancer nurse navigator. And what that is a person who's essentially your tour guide. They take you to your appointments, they help you understand the diagnosis, help you with making the appointments, and that's in addition to having all of your doctors around you. Breast cancer, like I said, can be an overwhelming diagnosis, and more so we're seeing survivors today. And so there is support services that we have available here to cope with it, and we have a survivorship program, and I think that's very, very important for a community and for oncology in general.
Yeah, it's certainly making a difficult situation to go through a little bit easier here at Aurora. Thank you for taking some time with us today, and welcome to Oshkosh.
Thank you.
Now, if you have a family history of breast cancer, or you're concerned or have any questions about risk factors, you can always call your primary care provider or Dr. Virani here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.